Another day of me sharing interesting videos with you guys. Hello and welcome to my channel. If you're new here, then please do subscribe to my channel because you will find my videos intriguing. Some are fun, some are emotional, and some are educational. More reason you need to click on that notification bell so that you should be notified every time I post a video. Okay, let's get into the video. In this video, a palm color labor and delivery nurse highlights how the US is the worst place to have a baby if you are black in the developed world. Now, she also states how black women are more likely than any other race to be in pregnancy. So she says this has made her treat black patients, especially those in labor, differently. Here's her video.
I'm well aware that what I'm about to say could get me in a lot of trouble, but I think it's important enough to say. I'm a labor and delivery nurse, and I treat my black patients differently. I've seen nurses, especially labor and delivery nurses, online saying things like, "I'm colorblind, I don't treat my patients any differently," meaning that they don't treat their black patients worse than they treat their white patients. And here's why it's not enough to be a colorblind nurse in 2023. Because I know that in my specialty, labor and delivery, black women are more likely than any other race to be harmed in pregnancy, childbirth, and beyond. The US is the worst place to have a baby if you're black in the developed world. Why is this not happening anywhere else? Systemic racism. If you don't believe me, just Google James, Mary, and Sims. So not only are black women not believed about their pain, not believed about their symptoms, but also they may put off getting something checked out because they don't trust medical providers for good reason. So here's how I treat my black patients differently. Number one, I don't expect them to inherently trust me because I'm wearing scrubs and a badge, and I don't get offended if they don't. Many black women are coming in to have a baby already having experiences of not being listened to. And until I'm able to prove to them that I'm someone that can be trusted, they shouldn't trust me. More than my white patients, I emphasize the fact that I will always believe them. Yes, my white patients know also that I will believe them, but I really drive it home that I promise you that I'm going to believe everything that you say. I include every single person in the room who is supporting this patient in a conversation about preeclampsia, even if they don't have it. Because preeclampsia is one of the leading causes of maternal mortality in the United States. And preeclampsia can happen even after you've had your baby. I tell them about the symptoms, and I also tell the support people that if you hear her saying any of these things, make sure that she gets seen. And if when she gets seen, you don't feel like she's being listened to, go somewhere else. I let them know that I'm here to be their birth bouncer. And I'm not going to let anyone do anything to them, only for them and their baby with their permission. I can neither confirm nor deny whether I have slapped a provider's hand away when the patient said no. I don't know anything about that. I have no hard data to back this up, but I have a hypothesis that black women are not being repositioned in labor as much as white women. So my patients know, and I will say this, that I'm going to turn you like a rotisserie chicken because movement is gold in labor, especially after you have an epidural. If when we have a baby, I don't like the amount of bleeding that I'm seeing, I am early talking to that provider about, hey, what do you think about maybe giving a little bit of Cytotec? What do you think about putting in a Jada? Because postpartum hemorrhage is the leading cause of death. I will always use whatever privilege I have to make sure that my patients are heard. That's why it's so important to treat your black patients differently. And if you're a colorblind nurse, you're part of the problem.
A few days ago, I posted a video talking about how dangerous it is to have a child in the US as a black woman. Black women are treated differently from other races. Many of the times they are not listened to when they are either saying something or telling their doctors or delivery nurse how or what they are feeling. Many of the times that they are ignored, and this video just proves that what was said in that video is the truth. Now, because of systemic racism, black women are treated differently, hence leading to a lot of childbirth unalivings. Let's check out these teachers, and when I get back, we talk more about this.
And I'll take it a step further, because a long time ago, I realized that if hospitals and doctors actually cared about decreasing the amount of black mothers that are dying, they would simply just make protocol, because all the other things that they feel like are important, they make it into protocol, even when there's not substantial data to back up it being effective at improving birth outcomes. Vaginal exams do not improve birth outcomes. Giving birth on your back does not improve birth outcomes, but it's protocol. So in light of this conversation, here are some things that I think would make sense to make mandatory in the hospital every time a black mom walks through the door. Let her know that a patient advocate is available to her anytime that she feels disrespected or ignored, and that at any time she can stop working with her current provider and request a new one, and verbally tell this to her when she comes in. During prenatal visits, she needs to be encouraged to get a doula, and if it's difficult for her to find one, resources need to be well integrated into the system so that she can get one. Some sort of a reporting system where after a Black mother has given birth, they're collecting data on how her birth went, the outcome of the baby, and then her personal experience, and then quantify that into a score, and then openly display that score in the hospital so that before we even go into L&D, we know, does this hospital have a good standing reputation and outcome for Black mothers? And then if a hospital goes below a certain standard on that score, then there's some reprimanding that comes with that, like they lose certain privileges or something. There would be some sort of a patient documentation system so that we would know how many times did this mom ask for somebody to come and check on her before y'all actually came and check on her, and how many times did she get ignored. We will be doing some sort of in-home visits because 6 weeks is a long time between having a baby and being seen by the person who is supposed to be your provider. Yearly implicit bias training, because it could take some time to realize that you have your bias, and it could take some time to undo that. I mean, I can go on and on about this, and if you have more ideas of what should be a part of like a Black Mama protocol, you can put them in the comments. But I think it really is important that creators like this, nurses like this, hold each other accountable to help change the issues that they're seeing.
What she said is super important, and it brings me to another dope ass story time. But this one wasn't so dope. It was about the time that I gave birth to my firstborn son, and I went through an experience where I was not believed, not listened to, and not given any bodily autonomy during labor. And I think it was a little bit traumatic, but y'all tell me. So I was a first-time mother, 21 years old, never given birth, never been to anybody's birth, never saw anybody through pregnancy. This is my first time experiencing pregnancy firsthand. So about 10 days before my due date, middle of the night, I wake up with like excruciating pain in my abdomen. I was living with my mother at the time, so I go to her and I'm like, hey, something ain't right. I'm hurting. I'm in pain. She immediately is like, that's contractions. Let's start timing it. We time them. They're about 5 minutes apart. At the time, I lived about 20 minutes away from the hospital that I was supposed to be delivering at. So I call the nurse and I tell them, hey, I'm having contractions. They're 5 minutes apart. What do I need to do? They tell me, come on in. Now, mind you, I have a pretty high threshold for pain, which is not a good thing to have if you're a Black woman. And it's something that probably occurs because of people not believing your pain historically. And so you learn to just kind of eat your pain, swallow it, take the L. So I'm someone who had really bad menstrual cramps growing up. And so these were feeling like really bad cramps to me. I'm waiting for it to get worse, right? Which raises a good point about pain scales. You know, what's a 10 to someone else may not be a 10 to you based on your past experiences, right? If you've experienced pain that was worse than this, you might not register your pain as a 10 on the pain scale. So I get to the hospital, my mom drops me off at the emergency room door and she goes to park the car. As I'm walking in, I have to like stop at the doors because I am in such pain I can't walk. Now, the woman at the intake counter sees me doing this. She sees that I'm visibly pregnant. However, I am 5'11". I'm pretty tall, so I wasn't as big as you might expect a 9-month pregnant woman to be. So I get to the counter, I tell her I'm 9 months pregnant and I feel like I'm in labor. She sips her soda, puts it down. She looks at me and she says, I need your ID and your insurance card. I'm shuffling through shit. I find it. I give it to her. I'm like, hey, is there any way that I can just go ahead and go? Wait, we have to get you checked in and I have to print your bracelet out before we can do anything. Just calm down. I calm down. She takes her time. She's asking me all these questions. I'm like, hey, I'm in really bad pain. Like, I think I need to go. I need to go now. I don't have time for this. There's nothing we can do until we get you this bracelet. So you're going to have to work with me if you really want to be seen. I'm 9 months pregnant. So they send the smallest woman in the hospital to come get my big ass. I was over 200 pounds at this point, and she's pushing me to the labor and delivery section of the hospital, which happens to be uphill for some reason inside the hospital. She's telling me the whole time, well, you don't look like you're in too much pain, so we're probably just going to send you back home, but we'll send you up here and check you just in case. She gets me to the room, checks me, and I am 10 centimeters dilated. She's like, everybody hurry, get the beds ready.
If you haven't seen Jen's video, you need to go watch it. It's great, and she does an amazing job talking about this. Nurses should not have to advocate twice as hard for our patients of color, but we do. The other day I had 2 patients, one Black, one white. My black patient was in 10 out of 10 pain with 0 drug history. My white patient had a 4 out of 10 headache. Do you want to know what they got for pain meds? One of them got oxycodone. The other one got Tylenol. I didn't have to ask for the oxy. And it took me 4 hours to get something other than Tylenol for the 10 out of 10 pain. The systemic racism in healthcare needs to be fixed.
I am shaking.
So that comment was made on a video that Jen posted about why she treats her black patients differently. Please go back to watch her videos. So that comment is saying that the reason for the disparities that we see, the racial disparities that we see in maternal mortality is because of people not getting prenatal care. And that these people are usually married, educated, competent black women. That is absolutely not true. This article right here was just published in February of this year. Childbirth is there for black families even when they're rich, expansive study finds.
This is why I'm so grateful. A chicken just flew out of the tree. This is why I'm so grateful for the platform that I have, because we can have conversations about important things just like the question that you just asked. So in the video that this comment is in response to, I mentioned that I treat my black patients differently because they are 4 times more likely to die in childbirth than a white woman. So if I was to treat my black patients the same as all my other patients, I would be perpetuating the 4 times more likely to die thing. But as a nurse, I am trained to assess and provide individualized care for each patient. So if I have a patient who speaks Arabic, I am going to provide them with an interpreter. I am not going to provide Jessica in 203 an interpreter because she speaks English. She doesn't need that care. If my patient in 216 needs her blood sugar checked because she is a gestational diabetic, I'm not going to go next door and check their blood sugar because I did that for the person in the last room. If I know that the baby that my patient is carrying is a product of grape, I'm going to treat them differently because they need more specialized care. They need to feel safe and supported and protected, even more so than somebody who hasn't had that trauma. So I treat my black patients differently because they need different care. And I have to work harder for those patients to combat the fact that I know that they are 4 times more likely to die in childbirth. So I don't expect them to trust me. I don't get offended if they don't trust me. So that's why I do not strive for equality. Equality is a no-no. I strive for equity. Equality is giving everybody the same thing. Equity is giving people what they need to be successful. So yeah, I'm not afraid to say that I'm a nurse and I treat my black patients differently. And I hope you do too.
And let me start with sharing how people reacted to this in the comments. The comments read, "That's so sad. I would hope doctors would be educated enough to not have racism impact their decisions. Perhaps they should have some continuing. Awful. This generation in healthcare, I'm hoping the racism in the health system will end." This one says, this one nurse told me she couldn't give me my pen meds. She said she just couldn't without an explanation. Maybe doctors or nurses should have their own scores too, and if it falls below the threshold, they specifically lose privileges while they repeat training. It is so sad that people aren't informed about their rights the way they should. I didn't know this was a thing until I saw an episode on The Resident based on a true story with this, and it ripped out. This is terrible. I'm a black woman. I've had non-medication assisted childbirth twice, and I have never been repositioned unless I repositioned myself. Okay, these are some of the comments from people, and trust me, there are a lot. Some sad experiences, but all this points back to what this nurse is saying in the video. Now, it is real and it is happening. Just like she said about Googling James Marion Sims, I did my research and found out this. Credited as the father of modern gynecology, Sims developed pioneering tools and surgical techniques related to women's reproductive health. In 1876, he was named president of the American Medical Association, and in 1880 he became president of the American Gynecological Society, an organization he helped fund. The 19th century physician has been lionized with a half dozen states around the country, but because Sims' research was conducted on enslaved black women without anesthesia, medical ethicists, historians, and others say his use of enslaved bodies as medical test subjects falls into a long ethical history that includes the Tuskegee syphilis experiment and Henrietta Lacks. Critics say Sims cared more about the experiments than in providing the therapeutic treatment, and that caused untold suffering by operating under the art to the cyst notion that black people did not feel any pain. Now, Sims, who practiced medicine at a time when treating women was considered distasteful and rarely done, invented the V speculum, a tool used for dilation and examination. Now, he also pioneered a surgical technique to repair VV fistula, a common 19th complication of a child in which a tear between the uterus and bladder caused constant pain and urine leakage. Now, his defenders say the Southern-born slaveholder was simply a man of his time for whom the end justified the means, and that enslaved women with fistulas were likely to have wanted the treatment badly enough that they would have agreed to take part in his experiments. But history hasn't recorded their voices and consent from their owners, who had a strong financial interest. Recorded their voices and consent from their owners, who had a strong financial interest in their recovery, was the only requirement of the time. Now, Sims wrote that the women had clamored for the operations to relieve their discomfort, but whether they concerted or not was not captured in any other historical record. Today, we know 3 of the names of the female patients from Sims' own record. The first one he operated on was an 18-year-old who had given birth a few months prior and hadn't been able to control her bladder since. Now, the process was so painful as she endured an hour-long surgery, screaming and crying out in pain. Nearly a dozen of other doctors watched. Now, the girl later became very ill, and Sims thought she was even going to be unalive, but it took like 2 to 3 months to recover entirely from the effects of the operation. Now, for a long time, his surgeries were not successful. After 30 operations on one woman, a 17-year-old woman who had a very traumatic labor and delivery, he finally perfected his method after 4 years of experimentation. Now, you can imagine how many black women were experimented on in that 4 years. Afterwards, that's when he began to practice on women using anesthesia, which was new to the medical field at the time. While some doctors didn't trust anesthesia, Sims' decision to not use it or any other numbering technique was based on his misguided belief that black people didn't experience pain like white people did. It is a notion that persists today, according to a study conducted at the University of Virginia and published in the April 4, 2016 proceedings of the National Academy of Science. Thank you for watching, and please don't forget to share what you think about this video. I want to hear your thoughts on this.